differentiate between the types of amblyopia, and discuss the implications of each type for treatment strategies. Answer: amblyopia, often referred to as lazy eye, can be categorized into three main types: strabismic, refractive, and deprivation amblyopia. Strabismic amblyopia. This type occurs due to misalignment of the eyes, strabismus, causing the brain to favor one eye over the other. As a result, the visual acuity of the misaligned eye diminishes over time. Treatment typically involves methods to correct the strabismus, such as prism therapy or surgery combined with patching or atropine drops to encourage use of the weaker eye. Refractive amblyopia. This condition is caused by significant differences in refractive error anisometropia between the two eyes. The brain ignores input from the eye with poorer vision to avoid double vision. The treatment involves prescribing corrective lenses to equalize vision between the two eyes, followed by patching or vision therapy to enhance the weaker eye's function. Deprivation amblyopia. This occurs when visual experience is obstructed, such as by a congenital cataract. Timely surgical intervention is critical. Cataract extraction must be performed early to restore visual input and prevent permanent vision loss. Post-operative management may include patching and corrective lenses. Implications for treatment. Understanding the underlying cause is crucial for effective intervention. For strabismic and refractive amblyopia, early detection and intervention through appropriate therapy are vital to improve outcomes, while deprivation amblyopia necessitates prompt surgical correction. At what age do significant milestones in visual development occur, and how do these milestones influence screening protocols in pediatric ophthalmology? Answer: visual development in children follows a series of milestones that inform screening protocols. Birth to 1 month. Infants exhibit blinking to bright light and preference for high contrast patterns, which is why visual screening begins soon after birth through examinations by pediatricians. 2 to 3 months. Infants start tracking objects and developing depth perception. Pediatricians may monitor for these skills during routine checkups. 4 to 6 months. Recognition of faces and improved hand-eye coordination are noted. Pediatricians often recommend checking visual responses at this stage. 7 to 12 months. Color vision develops and infants begin to see in 3D. Screening should include assessments of visual acuity and tracking abilities. 12 months to 2 years. Refinement of visual acuity occurs and 20/30 vision is expected by age 3. This is a critical age for formal vision screening to identify potential issues. 2 to 3 years. Continued development of fine motor skills and visual processing. Screening is typically conducted at ages 3, 4, and 5. Especially for children at risk due to family history or premature birth. Influence on screening protocols. Understanding these milestones allows healthcare providers to tailor screening protocols effectively, ensuring that potential visual impairments are detected early when they are most amenable to treatment. Explain the importance of the Hirschberg test and cover test in the diagnosis of strabismus. How do these tests inform treatment options? Answer: the Hirschberg test is a quick, non-invasive method to assess ocular alignment by shining a light in the patient's eyes and observing the reflection, corneal light reflex. Ideally, the reflection should be symmetrical. A deviation indicates strabismus, with the degree of misalignment providing insight into the severity. The cover test complements the Hirschberg test by assessing eye movements and alignment. In this test, one eye is covered while observing the uncovered eye's movement. If the uncovered eye moves to fixate on the target, it indicates that the covered eye was not aligned, i.e., strabismus is present, informing treatment options. Both tests are essential for diagnosing the type and degree of strabismus, influencing the choice of treatment. For example, a significant misalignment may lead to surgical options, while a lesser degree might be managed with prism therapy or vision therapy. Accurate diagnosis is critical for developing an effective treatment plan. Mr. Thompson, a 5-year-old, is brought to the clinic with concerns that he often covers one eye to see better and has trouble reading the board at school. His mother mentions that he has a family history of eye problems. What steps should the ophthalmologist take to evaluate Mr. Thompson's condition, and what potential diagnoses should be considered? Answer: the ophthalmologist should undertake the following steps. Comprehensive eye examination. A thorough history should be obtained, including family history of amblyopia, strabismus, and other eye conditions. Visual acuity testing. Utilize age-appropriate tools, e.g. Snellen chart, Lee symbols, to measure visual acuity in each eye. Hirschberg and cover tests. Perform these tests to assess ocular alignment and diagnose potential strabismus. Refraction testing. Determine any refractive errors, e.g. anisometropia, that could contribute to symptoms. Assess for amblyopia. Based on findings, evaluate for amblyopia, considering types such as strabismic, refractive, or deprivation amblyopia. Potential diagnosis: strabismus. given the covering of one eye. Strabismus is a likely consideration. Refractive amblyopia, if a significant refractive error is found between the eyes. Deprivation amblyopia, if any obstruction, e.g. cataract, is observed during the examination. Discuss the identification and management of congenital cataracts, focusing on the timing of intervention and post-surgical care. Answer: identification. Congenital cataracts are often detected at birth through routine examinations or by parental observation of abnormal eye appearance. Key indicators include cloudy or opaque lenses visible on examination. Management. Timing of intervention. Early surgical intervention is crucial, ideally before 6 weeks of age, to prevent amblyopia and allow for proper visual development. The surgery typically involves cataract extraction and intraocular lens implantation may be performed, depending on the age and condition of the eye. Post-surgical care. After surgery, management strategies should include patching to encourage the use of the operated eye and prevent amblyopia. Corrective lenses. Prescription glasses may be necessary to enhance visual acuity. Follow-up care. Regular follow-up appointments are critical to monitor healing and adjust treatment plans as necessary. Implications. Proper management of congenital cataracts is essential to ensure optimal visual development and prevent long-term visual impairment. This involves a coordinated approach among pediatricians, ophthalmologists, and families. Explain the significance of screening guidelines for pediatric populations and identify the key risk factors that necessitate closer monitoring. Answer: significance of screening guidelines. Routine vision screening in pediatric populations is essential for early detection of visual impairments that can hinder developmental milestones and academic performance. Guidelines recommend screening at ages 3, 4, and 5 as critical periods for visual development occur during these years. Key risk factors. Family history of eye conditions. Children with a family history of amblyopia, strabismus, or refractive errors are at higher risk and should undergo more frequent screening. Premature birth. Infants born prematurely are susceptible to visual impairments, necessitating vigilant monitoring. Developmental delays. Children with developmental delays may exhibit delayed visual development, warranting early and regular assessments. Previous eye conditions. Any history of eye surgery or congenital abnormalities should trigger ongoing eye evaluations. Conclusion. Identifying these risk factors allows for timely intervention, which is crucial for minimizing long-term visual deficits and enhancing overall development. Evaluate the role of treatment adherence in the management of amblyopia and discuss strategies to enhance compliance among pediatric patients. Answer: role of treatment adherence. Adherence to amblyopia treatment is vital for achieving optimal visual outcomes. Non-compliance can lead to suboptimal results, with potential permanent visual impairment in the amblyopic eye. Strategies to enhance compliance. Education for parents and children. Providing clear explanations of the importance of treatment and potential outcomes can empower families to commit to the regimen. Engaging treatment methods. Utilizing enjoyable methods, e.g., games or digital apps, can make patching or vision therapy more appealing to children. Routine monitoring. Regular follow-up visits to assess progress can reinforce the importance of adherence and provide opportunities for parents to discuss challenges. Reward systems. Implementing reward systems for adherence can motivate children to follow through with treatment protocols. Conclusion. Enhancing compliance requires a multifaceted approach that involves education, engagement, and regular support to optimize visual outcomes in amblyopic patients. Discuss the indications for and the principles behind prism therapy in managing strabismus in pediatric patients. Answer: indications for prism therapy. Prism therapy is indicated in the management of strabismus when surgical intervention is not warranted or feasible. There is a need to improve binocular function or visual comfort. The patient has a deviation that can be compensated for by optical means, providing immediate relief from symptoms like diplopia. Principles behind prism therapy. Optical deviation compensation. Prisms bend light before it enters the eye, effectively altering the angle of light to facilitate alignment without surgery. This compensatory method can improve alignment for certain angles of deviation. Facilitation of binocular vision. By reducing the effort required to maintain binocular fusion, prism therapy can enhance visual comfort and reduce symptoms of diplopia. Customizable treatment. The strength and direction of the prism can be tailored to the specific needs of the patient, making it a versatile treatment option. Identify common ocular emergencies in pediatric patients and outline an initial management approach for each. Answer: common ocular emergencies. Corneal abrasion, typically caused by trauma or foreign bodies. Initial management includes irrigation to remove foreign materials, topical antibiotics to prevent infection, Pain management with topical analgesics. Chemical burns. Urgent management is critical. Initial steps include immediate irrigation with copious amounts of saline or water for at least 15 minutes, referral to an ophthalmologist for further evaluation and treatment. Traumatic hyphoma, blood in the anterior chamber often due to blunt trauma. Initial management includes head elevation and strict bed rest, monitoring for intraocular pressure and referral for further evaluation. Insect bites or animal bites. Management should focus on thorough cleansing of the wound, tetanus prophylaxis if necessary, antibiotics for prevention of infection and referral for potential surgical intervention. Conclusion. Prompt recognition and management of ocular emergencies are vital to prevent long-term complications in pediatric patients. Parents and caregivers should be educated about potential emergencies and the importance of seeking immediate medical attention. What are the key considerations in diagnosing and managing uveitis in pediatric patients? Answer. Key considerations in diagnosis: history and symptoms. Obtain a thorough history including any systemic symptoms, fever, rash, and family history of autoimmune diseases. Symptoms may include photophobia, redness, and decreased vision. Examination findings. Slit lamp examination is essential for assessing anterior segment inflammation, presence of cells and flare in the anterior chamber, and vitreous opacities. Systemic evaluation. Pediatric uveitis often associates with systemic conditions, e.g. juvenile idiopathic arthritis. A comprehensive evaluation for underlying causes is crucial. Management strategies. Topical corticosteroids used to reduce inflammation in anterior uveitis. Systemic medications. For more severe cases or posterior uveitis, systemic corticosteroids or immunosuppressive therapy may be required. Ongoing monitoring. Regular follow-ups to assess response to treatment, monitor for complications, and adjust medications accordingly. What are the key anatomical structures involved in cataract surgery, and why is their understanding critical for surgical success? Answer. Understanding the key anatomical structures involved in cataract surgery is vital for ensuring the safety and efficacy of the procedure. The primary structures include the cornea, anterior chamber, iris, lens, zonules, and vitreous body. The cornea is the main refractive surface of the eye, and any damage to it can lead to significant complications such as corneal edema or opacity. The anterior chamber, located between the cornea and the lens, should be assessed for depth, as a shallow chamber increases the risk of posterior capsule rupture during surgery. The lens is the target of cataract surgery, and its anatomical relationships with the zonules, which connect the lens to the ciliary body, are critical. Disruption of zonules can lead to lens dislocation postoperatively. An understanding of these structures also helps surgeons avoid damaging the retina, which is posterior to the lens. Surgeons must be aware of anatomical variations and preoperative assessments such as optical coherence tomography or ultrasound biomicroscopy, which can aid in planning the surgery. By having a thorough grasp of these anatomical components, surgeons can execute procedures more safely and effectively, minimizing risks and improving patient outcomes. What are the advantages and disadvantages of using local anesthesia compared to general anesthesia in ophthalmic surgeries? Answer. Local anesthesia is commonly employed in ophthalmic surgeries due to its numerous advantages. It provides targeted analgesia, allowing patients to remain awake and cooperative during procedures, which is particularly beneficial in surgeries such as cataract extraction or glaucoma filtration. The rapid recovery associated with local anesthesia enables patients to be discharged soon after surgery, reducing overall healthcare costs and minimizing systemic risks, especially in older patients who may have comorbidities that complicate general anesthesia. However, local anesthesia can pose challenges such as anxiety in patients who may be uncomfortable being awake during the procedure. In contrast, general anesthesia offers complete unconsciousness and immobility, which can be beneficial for complex surgeries that require prolonged operation times, such as vitreoretinal surgery. While it provides a controlled environment, general anesthesia carries risks of respiratory depression, cardiovascular complications, and a longer recovery time. Ultimately, the choice between local and general anesthesia should be based on the complexity of the surgery, patient health status, and individual preferences. Proper preoperative assessment and discussion with the patient are essential to ensure informed consent and optimize surgical outcomes. Describe the sterilization protocols necessary to prevent infection in ophthalmic surgery. Answer. Infection control in ophthalmic surgery is paramount to prevent complications such as endophthalmitis. Essential protocols include strict adherence to hand hygiene practices such as thorough hand washing and using alcohol-based hand sanitizers by all surgical personnel before and during procedures. Surgical instruments must be sterilized using validated methods, primarily autoclaving, which effectively eliminates microbial contamination. The operating room environment must also be meticulously maintained. This involves regular cleaning and disinfection of surfaces, use of proper air filtration systems to reduce airborne pathogens, and controlling personnel traffic to limit the number of individuals present during surgeries. Preoperative screening of patients for any existing infections is vital, and prophylactic antibiotics may be administered to high-risk patients to further reduce infection rates. Compliance with guidelines established by health organizations like the Centers for Disease Control and Prevention (CDC) and the American Academy of Ophthalmology is essential for lowering infection rates, thereby improving surgical outcomes and patient safety. What are the indications for trachelectomy, and what are the key postoperative considerations? Answer: trachelectomy is indicated for patients with glaucoma when intraocular pressure cannot be controlled through medication alone. This surgical procedure is particularly recommended for those with advanced glaucoma or significant visual field loss, as well as for patients who are intolerant to glaucoma medications or those who exhibit poor compliance with medical therapy. The procedure involves creating a fistula that allows aqueous humor to bypass the conventional drainage pathways, thus lowering IOP. Postoperative considerations are critical for ensuring the success of trachelectomy. Patients require close monitoring for complications such as hypotony, which can lead to shallow anterior chamber and potential retinal detachment. Follow-up visits are essential to evaluate the integrity of the filtering bleb and ensure that it remains patent. Signs of infection, such as increased pain, redness, or changes in vision, must be promptly addressed. Additionally, patients may be prescribed anti-inflammatory medications to reduce scarring at the surgical site and to promote healing. Regular assessments and patient education about recognizing potential complications can significantly enhance the long-term success of trachelectomy. Mr. Johnson is anxious about undergoing cataract surgery. He has read about potential complications and is uncertain about the risks involved. How should his surgeon address his concerns? Answer: the surgeon should approach Mr. Johnson's anxiety by initiating an open and honest conversation about cataract surgery. First, it is important to acknowledge his concerns and provide reassurance. The surgeon should explain the cataract surgery process in a straightforward manner, outlining what to expect before, during, and after the procedure. Emphasizing the high success rates and the commonality of the surgery can help alleviate fears. Next, the surgeon should discuss the risks involved, including potential complications like infection, bleeding, and retinal detachment, while providing context around these risks based on current clinical data. For example, the risk of endophthalmitis is very low, typically cited at less than 1% in contemporary practice due to advancements in surgical techniques and strict adherence to infection control protocols. Encouraging Mr. Johnson to ask questions can facilitate a better understanding and foster trust. Providing educational materials that outline the risks and benefits alongside testimonials from other patients can also be helpful. Ultimately, reinforcing that informed consent is a collaborative process that allows Mr. Johnson to feel more empowered and confident in his decision to proceed with the surgery. What are the common surgical complications associated with cataract surgery, and how should they be managed postoperatively? Answer: common surgical complications associated with cataract surgery include posterior capsule ossification, PCO infection, endophthalmitis, retinal detachment, and corneal edema. PCO, the most frequent complication, occurs when the capsule holding the intraocular lens becomes cloudy, leading to decreased vision. It can typically be managed with a simple outpatient procedure called YAG laser capsulotomy, which restores clarity to the visual pathway. Endophthalmitis, although rare, is a severe infection that requires immediate attention. Symptoms may include redness, pain, and decreased vision. Treatment often involves intravitreal antibiotics, and in severe cases, surgical intervention may be necessary to clear the infection and salvage vision. Retinal detachment is another critical complication, presenting with symptoms such as flashes of light, floaters, or a shadow in the peripheral vision. Corneal edema can occur due to surgical trauma or pre-existing conditions. Management may involve topical hypertonic saline or other medications to reduce corneal swelling. Close follow-up care is essential for all postoperative patients to monitor for these complications and address them swiftly to optimize surgical outcomes and preserve vision. Discuss the role of phacoemulsification in cataract surgery and its advantages over traditional extracapsular cataract extraction. Answer: phacoemulsification has revolutionized cataract surgery by providing a less invasive approach compared to traditional extracapsular cataract extraction. The phacoemulsification technique involves using ultrasonic vibrations to emulsify the cataractus lens. which is then aspirated through a small incision, typically less than 3 millimeters. This minimally invasive nature leads to numerous advantages, including reduced trauma to surrounding tissues, faster recovery times, and decreased postoperative discomfort. One of the key benefits of phacoemulsification is the preservation of the capsule, which supports intraocular lens IOL placement and helps maintain the eye's structural integrity. The smaller incision size leads to fewer complications related to wound healing and significantly lowers the risk of postoperative astigmatism, resulting in better visual outcomes. Additionally, patients experience a quicker return to normal activities, with many able to resume daily tasks within a day or two post-surgery. Phacoemulsification also allows for greater flexibility in IOL options, including toric and multifocal lenses, which can be tailored to individual patient needs, enhancing visual acuity and quality of life postoperatively. What postoperative care strategies should be implemented after glaucoma surgery? Answer: postoperative care after glaucoma surgery, such as trabeculectomy or the placement of glaucoma drainage devices, is critical for ensuring optimal outcomes and preventing complications. Immediate postoperative care includes close monitoring of intraocular pressure to ensure that it remains within the desired range. IOP should be measured frequently in the days following surgery, particularly within the first week, to detect any signs of hypotony or excessive filtration. Patients are often prescribed topical medications, including anti-inflammatory and antibiotic drops, to minimize inflammation and prevent infection at the surgical site. It is crucial to instruct patients on the correct administration of these medications to enhance adherence and effectiveness. Follow-up appointments are vital for assessing the integrity of the filtering bleb and ensuring that there are no signs of obstruction or scar formation. Patients should be educated on recognizing potential complications such as sudden vision changes, increased redness, or pain, and instructed to report these immediately. Additionally, activity restrictions may be necessary in the early postoperative period to avoid increased IOP, including avoiding heavy lifting, bending over, or engaging in strenuous exercise. Explain the principles of ocular surgery and how they relate to surgical outcomes. Answer: the principles of ocular surgery encompass several fundamental concepts that are crucial for achieving optimal surgical outcomes. Key principles include an understanding of surgical anatomy, an appropriate selection of surgical techniques, and meticulous attention to intraoperative and postoperative care. Firstly, knowledge of surgical anatomy is essential to avoid complications and ensure that the intended surgical objectives are met. Surgeons must have a thorough understanding of the layers of the eye, including the cornea, sclerouvea lens, and retina, as well as their relationships to surrounding structures. This anatomical knowledge allows for the precise placement of incisions and the avoidance of critical structures during surgery. Secondly, selecting the appropriate surgical technique is vital. For example, in cataract surgery, phacoemulsification is often preferred over traditional extracapsular extraction due to its minimally invasive nature, leading to quicker recovery times and lower complication rates. The choice of anesthesia, local versus general, also affects patient comfort and surgical efficiency. Additionally, principles of hemostasis and the management of intraocular pressure during surgery are crucial. Maintaining a stable IOP prevents damage to retinal structures and ensures the visibility of surgical fields. Surgeons must also implement strict infection control measures to reduce the risk of postoperative endophthalmitis. Postoperative care, including follow-up appointments and patient education, is also essential. Monitoring for complications such as infections, inflammation, or IOP fluctuations ensures that any issues are promptly addressed, ultimately leading to improved patient outcomes. By adhering to these principles, surgeons can maximize the effectiveness of their interventions and enhance patient safety. What are the psychological aspects of patient care in ophthalmic surgery, and how can they influence surgical outcomes? Answer: the psychological aspects of patient care in ophthalmic surgery are crucial as they can significantly influence both patient compliance and surgical outcomes. Many patients experience anxiety related to the prospect of surgery, fear of potential complications, and concerns about postoperative vision changes. Addressing these psychological factors is essential for optimizing the patient's surgical experience and enhancing outcomes. First, effective communication between the surgeon and the patient is paramount. Providing clear, thorough information about the surgical procedure, expected outcomes, and potential risks helps demystify the experience and alleviate fears. Surgeons should encourage patients to express their concerns and questions, fostering a supportive environment where patients feel heard and understood. Second, implementing preoperative counseling can be beneficial. Techniques such as guided imagery or relaxation exercises can help reduce pre-surgical anxiety, leading to a more positive surgical experience. Additionally, educating patients about what to expect during recovery can empower them, making them more likely to adhere to postoperative care instructions and attend follow-up appointments. Furthermore, understanding the patient's psychological state can assist surgeons in tailoring their approach. For example, patients with a history of anxiety or depression may require additional support, such as referrals to mental health professionals or the use of anxiolytics in conjunction with anesthesia. Overall, acknowledging and addressing the psychological aspects of patient care can lead to increased patient satisfaction, improved adherence to postoperative instructions, and better surgical outcomes, emphasizing the importance of a holistic approach to ophthalmic surgery. What is the significance of distinguishing between prevalence and incidence in the epidemiology of ocular diseases, and how can this understanding influence public health policies? Answer: prevalence and incidence are critical epidemiological measures. Prevalence refers to the total number of existing cases of a disease within a population at a specific time, whereas incidence denotes the number of new cases that develop within a specified period. Understanding these measures allows public health officials to assess the burden of ocular diseases, allocate resources effectively, and plan interventions. For instance, if the prevalence of diabetic retinopathy is high in a community, public health initiatives might prioritize screening programs and patient education on diabetes management. Conversely, a rising incidence of age-related macular degeneration could indicate the need for targeted awareness campaigns about risk factors such as UV exposure and smoking. Accurate data on prevalence and incidence guides the implementation of screening guidelines, community health initiatives, and resource allocation to combat preventable blindness effectively. Describe the lifestyle and environmental factors that influence the risk of developing ocular diseases. What preventive measures can be implemented to mitigate these risks? Answer: several lifestyle and environmental factors significantly impact the risk of ocular diseases. Diets rich in fruits, vegetables, and omega-3 fatty acids are associated with a low risk of conditions like age-related macular degeneration and cataracts. Physical activity. Regular exercise helps manage chronic diseases such as diabetes, reducing the risk of diabetic retinopathy. UV exposure. Prolonged exposure to UV radiation increases the risk of cataracts and macular degeneration. Protective eyewear of blocking sunglasses can help mitigate this risk. Pollution. Exposure to air pollutants has been linked to dry eye and allergic conjunctivitis, emphasizing the need for public awareness and environmental regulation. Preventive measures include promoting healthy dietary habits, encouraging regular physical activity, emphasizing UV protection through community awareness campaigns, and advocating for cleaner air policies to reduce pollution's ocular impacts. Mr. Johnson, a 62-year-old male with a family history of glaucoma, visits your clinic for a routine eye examination. He has not had an eye exam in over 5 years. What steps should you take in his management plan, and what guidelines support your recommendations? Answer: in managing Mr. Johnson, the following steps should be taken. Comprehensive eye examination. Given his age and family history of glaucoma, a thorough eye exam, including intraocular pressure measurement and visual field testing, is crucial. The American Academy of Ophthalmology guidelines recommend that individuals over 60 undergo comprehensive eye exams annually or sooner if risk factors are present. Screening for glaucoma. Early detection is critical in preventing vision loss from glaucoma. Considering his family history, specific glaucoma screening tests like tonometry should be included in the examination. Patient education. Discuss the importance of regular eye exams, especially given his risk factors. Encourage Mr. Johnson to schedule annual exams moving forward. Follow-up and monitoring. Depending on the results, develop a follow-up plan to monitor his ocular health closely. These steps align with guidelines from the AAO, which stress the importance of regular screenings for individuals at risk of ocular diseases to facilitate early intervention and management. What role do community health initiatives play in reducing the prevalence of preventable blindness, and what strategies can be effectively implemented? Answer: community health initiatives are vital in raising awareness and promoting preventive measures against ocular diseases. Effective strategies include public awareness campaigns. Initiatives to educate communities about the importance of eye health and regular screenings can significantly lower rates of preventable blindness. For instance, campaigns promoting UV protection can encourage the use of sunglasses. School screenings. Implementing vision screenings in schools can help identify children with undiagnosed conditions such as amblyopia or strabismus, enabling timely intervention. Diabetes education programs. Since diabetes is a major risk factor for diabetic retinopathy, community programs aimed at educating diabetic patients about glycemic control and regular eye exams can significantly reduce the incidence of this condition. Collaboration with local health services. Partnering with local clinics and organizations to provide free or low-cost eye exams can improve access for underserved populations. These strategies align with public health principles and have been shown to reduce the incidence of avoidable ocular diseases effectively. How can genetic influences impact the risk of developing ocular diseases, and what are the implications for screening in at-risk populations? Answer: genetic factors play a significant role in the risk of developing several ocular diseases, including glaucoma and age-related macular degeneration. Family history is a well-established risk factor, necessitating targeted screening for those with relatives affected by these conditions. Familial screening. Individuals with a family history of ocular diseases should be screened more frequently than the general population. For example, the AAO recommends that individuals with a family history of glaucoma begin screening at an earlier age. Genetic counseling. Patients with known genetic predispositions may benefit from counseling to understand their risks and the importance of monitoring their ocular health. Tailored interventions. Identifying at-risk individuals allows for personalized interventions, including education about lifestyle modifications that may mitigate risk factors associated with hereditary ocular conditions. By incorporating genetic considerations into screening protocols, healthcare providers can enhance early detection and intervention efforts, ultimately reducing the prevalence of these diseases in high-risk populations. Explain the impact of environmental factors, such as air pollution, on ocular health, and propose strategies to address these issues at a community level. Answer: environmental factors, particularly air pollution, have been shown to adversely affect ocular health, leading to conditions such as dry eye and allergic conjunctivitis. Pollutants can irritate the ocular surface and exacerbate pre-existing conditions. To address these issues at a community level, the following strategies can be implemented. Public education campaigns. Raise awareness about the links between air pollution and ocular health, encouraging residents to take preventive measures such as using protective eyewear. Promotion of green spaces. Advocate for the creation and maintenance of parks and green areas to improve air quality, which may help reduce the prevalence of pollution-related ocular conditions. Collaboration with environmental agencies. Work with local environmental protection agencies to monitor air quality and develop policies aimed at reducing emissions and other pollutants. Encouraging healthy practices. Promote practices such as using air purifiers in homes and offices to minimize indoor pollution exposure. What are the guidelines for the frequency of eye examinations across different age groups, and how should these guidelines inform clinical practice? Answer: the frequency of eye examinations varies by age and risk factors based on guidelines from organizations such as the American Academy of Ophthalmology. Children. Initial eye exams should occur by age 1, followed by screenings at ages 3 and 5. Regular assessments should continue as needed to detect conditions like amblyopia early. Adults ages 1-8, 3-9. Comprehensive exams are recommended every 2-3 years, especially for individuals without risk factors. Adults ages 4-6-4. Exams should be conducted every 2 years to monitor for presbyopia and other age-related conditions. Adults over 65. Annual eye exams are recommended as older adults are at increased risk for cataracts, glaucoma, and macular degeneration. These guidelines should inform clinical practice by ensuring that healthcare providers offer appropriate screenings based on the patient's age and risk factors, promoting early detection and intervention for ocular diseases. Ms. Rivera, a 45-year-old woman with diabetes, is concerned about her risk of diabetic retinopathy. She has been managing her diabetes with medication but has not had an eye exam in over a year. What should Ms. Rivera's next steps be, and what guidelines support your recommendations? Answer: MS Rivera's situation highlights the importance of regular eye examinations for diabetic patients. The recommended next steps include: schedule a comprehensive eye exam. Given her diabetes and the absence of an eye exam in over a year, she should schedule an appointment for a comprehensive eye examination, including fundoscopic evaluation to check for diabetic retinopathy. Education on diabetes management. MS Rivera should be educated on the importance of maintaining glycemic control, as uncontrolled diabetes significantly increases the risk of retinopathy. Regular follow-ups. Depending on the exam results, establish a follow-up plan. Guidelines from the American Diabetes Association recommend that individuals with diabetes have their eyes examined annually, especially if they have risk factors or changes in vision. Consider referral to a specialist. If any signs of retinopathy are detected, a referral to a retina specialist may be warranted for further management. These steps are supported by guidelines emphasizing the critical role of regular eye examinations in preventing vision loss from diabetic complications. Discuss the importance of community health initiatives in promoting eye health, specifically in high-risk populations. How can these initiatives be effectively implemented? Answer: community health initiatives are essential in promoting eye health, particularly among high-risk populations such as the elderly, individuals with chronic diseases, and those with limited access to healthcare. Effective implementation can be achieved through targeted screenings, organizing free or low-cost vision screening events in community centers. Schools and senior living facilities can increase access for those who may not seek routine eye care. Awareness campaigns. Conducting public awareness campaigns focused on the importance of regular eye exams and education about risk factors associated with ocular diseases can empower individuals to prioritize their eye health. Partnerships with local organizations. Collaborating with local health departments, non-profits, and other stakeholders can enhance outreach and resource sharing, ensuring initiatives are well supported and reach those in need. Data collection and evaluation. Establishing mechanisms to collect data on screening outcomes and patient follow-up can help evaluate the effectiveness of initiatives and identify areas for improvement. What role does lifestyle modification play in the prevention of ocular diseases, and what specific recommendations can be made to patients? Answer: lifestyle modifications play a crucial role in the prevention of various ocular diseases. Specific recommendations for patients include healthy diet. Encourage a diet rich in antioxidants, vitamins A, C, and E, and omega-3 fatty acids to support eye health. Foods like leafy greens, carrots, fish, and citrus fruits should be emphasized. Regular exercise. Physical activity can reduce the risk of chronic diseases such as diabetes and hypertension, both of which are linked to ocular conditions. Aim for at least 150 minutes of moderate aerobic activity per week. Smoking cessation. Advise patients to quit smoking as it significantly increases the risk of age-related macular degeneration and cataracts. UV protection. Stress the importance of wearing UV-blocking sunglasses when outdoors to protect against harmful solar radiation that can contribute to cataract formation. Regular eye exams. Emphasize the need for routine eye examinations to monitor eye health and detect any conditions early.